Good afternoon, everyone, and thank you for joining today's eClaims webinar. My name is Anthony Contento. I'm a program manager within the eClaims unit, and joining me today is Mike Hunter, who is also a program manager within the eClaims unit. We ask that you please keep your phone lines muted, and also if you have any questions that you happen to wish to ask us, we ask that you please use the Q&A portion on which is located on the lower right-hand side of the screen. And when sending us your questions, I ask that you please select the All Panelists option. And you can also, if you so desire, hover over the WebEx tab that should be located at the top of your screen, and you can also select Q&A to submit your questions that way. Now, we will answer as many of your questions as we can, but if you have questions that you don't get to today, that you don't have an opportunity to send to us, or you think about it afterwards, please feel free to send it to us after today's presentation is over, and we'll be giving you contact information at the end of today's presentation. So with that, I'm going to go to the agenda. So as you can see, today's agenda, the first one is we'll be going over a couple of reminders for you. Second, we'll be going over the most frequent errors returned during the last 90 days, the top 3. And also, we're going to be discussing briefly requests for restoral of archived cases, the best avenue to take. Next, we'll be going over claim sender updates for prior authorization requests, or PARs. And then finally, as I stated earlier, we'll be going over questions that you have submitted to us today. So the first reminder we're going to be going over is requirements for supporting dependents. Some of the administrators have received rejections as they have not included the birth order when submitting the dependent payee relationship, which is DN0097. And so based on the IIBC claims standard, both the relationship and birth order are required when you submit that information. This is a 2A/N data element. Now, the data processing rule is that both positions must be populated with values before being sent to the jurisdiction. Birth order shall be reset for each relationship code that is used. For an example, dependent relationships of the widow and the son or daughter would be represented as 21 and 41, and then incremented by 1 for each additional qualifying dependent in that relationship classification. And when a birth order is greater than 9 applies, the alpha code values should be used then to represent the birth order. So here's an example. So DN0097, again, the dependent pay relationship. Relationship codes would be 2 for widow, 3 for widower, 4 for son or daughter, 5 for brother or sister, 6 for mother or father, 7 for disabled child, and then 8 is a jurisdiction fund, which is, or an estate, so a death without dependents fund, etc. And then the numerical birth order codes are listed as below. So 0 through 9, A equals 10, B equals 11, et cetera, as you can see on your screen. So now we're going to be going over the FROI AQAU on acquired claims, as well as discussing the FROI 02 on insure offend changes. So when acquiring a claim, the FROI AQAU should be filed on all active cases, including closed cases that medical is still being paid upon. And I want to remind you that, if you fail to file the AQAU, it could result in issues with the prior authorization request or the PAR's dashboard assignment. So, a TPA who should be getting it is not getting it because the FROI AQAU was not submitted. And then finally, the board could impose a Section 25(3)E penalty for failure to file a required form. Now, this penalty is actually imposed outside of the monitoring unit process, but could still be imposed at the case level based on the statute. So now going over some FROI 02 requirements, whenever insurer offend changes, remember to file a FROI 02 transaction whenever the insurer offend changes and you are paying indemnity and or medical, as again, this can affect the PAR dashboard assignment. Now, when the board receives a transaction and the insurer does not match our insurance company records based on proof of coverage reporting, a request for the FROI 02 is sent at that case level. Now, the FROI 02 should be filed, or a response to the request should be sent indicating the policy information so that a determination can be made to update that primary insurer on the applicable file. And again, as I stated in the previous slide, the board can impose a Section 25(3)(e) penalty for failure to file a required form. And again, this penalty would be imposed outside of that monitoring unit process, but could be imposed at the case level based on statute. So dealing with the FROI 00 UR/SA requirements, when indemnity is being paid, the FROI SA should be filed on all cases that indemnity is being paid on. A FROI 00 or a UR may need to be filed first, though, on old cases. Now, if another claim administrator has acquired the claim, just to remind you to please turn off your automatic FROI SA trigger. Now, failure to file these transactions could result again in issues with a prior authorization request, those getting assigned to the appropriate insurer/TPA. So again, you're seeing a pattern develop here when we're discussing these prior authorization requests. It is quite important to ensure that the claimant gets the treatment on time. And again, the board can impose a Section 25(3)(e) penalty to not filing the appropriate required form. And again, this penalty is outside of the monitoring unit process. So next up is Mike, who's going to be going over the most frequent errors.
Thank you, Tony. We'll go over the most frequent errors returned during the past 90 days and also give you an update on a previous error that had been in the most common error for the last 90 days, and again, the top error for 22 and 2023 was the carryover edit from Release 3.0. This population restriction is there to prevent new benefit type codes from being introduced as a suite benefit if they were not previously submitted as an event benefit or submitted as a suite benefit on the FROI UR grandfathered. This is based on the IAIBC Section 4 rules, so this is not just a New York rule, this is an IAIBC rule as well. And FTP filers should ensure their systems are programmed accordingly. The second most common error returned in the past 90 days, again a Release 3.0 carryover, is for DN75 agreement to compensate code to make sure it's sent with liability after the board has issued a notice that the case has been established with ANCR or ODNCR in accordance with Section 21A. And the third most common error returned in the past 90 days is one that we actually have not seen in the top 10 for a couple of years. This was a carryover edit from Release 3.0, and it's intended to force senders to only change DN87 net weekly amount on the appropriate MTC in accordance with the IAIBC Release 3.1 standard. The population restriction for DN87 net weekly amount states if it's non-AP, CA, CB, ER, IP, PY, RB, or SU, then the net weekly amount must match the value previously reported for DN85. FTP filers, again, we just ask that you appropriately code your systems and avoid those rejections in the future. We also wanted to give some good news. In the last webinar, our third most common error returned in 2024 was for DN281, the 064C error. This population restriction, we have began with the release 3.1 implementation in 2022. And it was just to make sure that we align lost time and knowledge dates in a logical timeline in our system. On January 18th of this year, we implemented changes. They were published in July of 2023 to change our severity rankings on several of the DNs from NA to AR, primarily on the Troy SA. This was to resolve the issue that had been reported by several trading partners regarding the latest value recognized in our system. Once we programmed and made DN281AR on January 18th of this year, it was quite apparent that some trading partners were likely sending DN281 on that Troy SA for several years. Since that edit didn't apply previously, we were ignoring it. Now we're not, and we asked trading partners to make changes. It appears that those changes were made, did not even make the top 10 for this quarter. So again, thank you for making those changes, and keep up the good work. Next, we just wanted to talk about requesting restoral of old archived, or some people may know them as paper cases. eClaims work group has been getting increasing number of requests. And we just wanted to issue a reminder that if a claim administrator finds they can't access an old file via eCase, you'll want to file an RFA-2 with the board's claims unit and request that that case be rebuilt if you need that case. If you have documents that you believe may not be in eCase, old decisions, you can attach those with the RFA-2 and they will scan those into the file. But again, that is handled by the board's claims unit. And we just want to issue that reminder. eClaims handles Troy-related questions, issues, rejections, and we do not typically handle the restoral of older cases. Last update we wanted to give was onboard related. For some of you that also work within the onboard system for prior authorization requests, you may notice occasionally that you receive a PAR for TPA that, or for another claim administrator. For example, you had a change on July 1st and you're no longer the TPA for a certain client. And as Tony mentioned earlier, everything drives off of those FROIs that you're filing. So if we don't have that FROI AQ or AU, you may get that PAR. Currently, you're administratively denying those PARs. We are soon to release an enhancement that will make it easier for claim administrators to take care of that PAR when it's received. So payer workload administrators will soon have the ability to have that prior authorization request moved to the correct claim administrator, eliminating that need to administratively deny the PAR. The new options will allow payers to request insurer review or update the claim sender of a prior authorization request if there is a recent change in the TPA. Two new actions will be in the workload administrator's drop-down for each PAR, and that will be request insurer review and update claim sender. The board will notify all payer workload administrators when a release date is announced. We'll also update the board's website to include instructions, screenshots like the one you see in the lower right-hand corner there. Requesting insurer review or updating claim administrator will only be able to be completed by a payer workload administrator when that PAR is in level 1 review status. It can only be done one time for that PAR. When completing either action, a pop-up display will prompt the workload administrator to submit proof of the responsible entity via uploaded documents or free text in order to proceed. So in that example I used before, if the TPA changed on July 1st, you'd be able to type in that free text box the relevant information and proceed with the update. Again, we will be releasing further information in the near future with a release date, but this is all based on feedback from the claim administrator community and asking for the ability to be able to move those versus have to deny them.
All right, thanks, Mike. So at this time, we'll be going through the questions that you've sent during the presentation. You know, as a reminder, please send your questions via the Q&A option that is in the lower right-hand corner of your screen or through the WebEx app portion towards the top of your screen. So you're going to hear some, brief silences from time to time as we go over your questions. So we'll be reviewing them now. Thank you.
We have a question about the onboard payer update, and will you be able to move it to a different carrier or only different administrator? There are going to be two options. You'll be able to move it to a different TPA if it just switched and that TPA has registered that W number. You'll also be able to request insurer review, and that actually will route to the board, and the board would look at that. And for example, if it was routed to ABC Insurance Company and it should have been GHI Insurance Company, the board will be able to move that to GHI Insurance Company for you.
All right, well, we actually only received a few of them that we were able to get through, but I want to thank you again for attending today's presentation. We value your input, and during the presentation as well as after the presentation. It's a working relationship that we have with each other, so your feedback is really appreciated, and it allows us to do our job better and maybe see things in a different light that we currently aren't viewing it at. We know your days are busy, and so thank you again for taking the time to spend a portion of your day with us. I want to point out a few ways that you can actually follow the board on social media. You can see it's X, formerly known as Twitter. You have Facebook, Instagram, and YouTube, where we post videos from time to time over a plethora of different topics. And also the board offers a WCB notification. So if you go to the board's website, wcb.ny.gov, scroll towards the bottom, you'll see an opportunity for you to select a Get WCB Notifications link. And within that, you can select multiple topics that you'd be interested in getting information sent directly to your email address, whatever email address that you provided within that process. So it is quite helpful. I have spoken to people in the past who appreciate getting those notifications right in their inbox and not needing to worry about hitting the board's website as often as they used to in the past. So, but again, thank you very much for attending today's presentation. I hope you have a lovely afternoon. Goodbye.